Cassie, and I'm here with Skin Wellness over in Homewood, and today we're going to talk about the Silk Infusion. So it's our version of the Microderm, but our famous Mercedes is going to be nice enough to let me demonstrate on you. So if you have any questions, feel free to ask. This is one of our most popular procedures we actually do, and it's our special for this month, so it's buy one get one free. So if you have any questions, you can feel free to comment. And Mercedes is the perfect candidate for this because she actually has very sensitive skin. So if you want to look close, right through here, you can see she's actually very irritated because she's been using Retin-A and she has rosacea. So I've been working on her for a very long time. So this is a good example of anybody's skin type is good for this. So it doesn't matter if you have acne or if you have rosacea or if you have problematic skin, we can work with you. We have multiple solutions with our Microderm, and so that's why it's very good to, for all skin types. And it gives you that immediate glow. This is actually her favorite treatment that she has done, and she has it once a month. So she has acne prone skin, and she also has rosacea. So she does the dermal infusion every single month with a 2% lactic acid, which just calms her skin down. And it doesn't have any downtime to it. So there's no peeling or there's no irritation. And feel free, Mercedes, if you want to give your own version of it.
So if somebody wants a Microderm, they can come in and you can suggest what the right solution will be for their skin type.
Exactly. So that's why with her, we have 4 different solution types. We have one which is for more calming down for the rosacea, and then we have another that's more for acne, and that has a salicylic acid in it. And then we have 2 other ones. It's more for skin brightening and a hydration, which are more for people that have any scarring or any irritation, and we can get rid of that too, hyperpigmentation.
What kind of tool do you use?
It has a diamond tip, so if you want to look, a lot of people like to see. So if you hold down, it actually fills up with a solution. So it's a diamond tip, and it fills up with a solution on the skin. So what I'm going to use on her is our Ultra Hydrating, and this is incredible for people that have rosacea, like Miss Mercedes. And then I'm also going to use another solution that is our Skin Clarifying. So this I use on a lot of our acne patients. So this is completely okay to use for people that also have acne prone skin that are not as sensitive as Mercedes is, and you can use this too. So I start out with one and then I move over to the other solution for people that want to address 2 different problems.
How long does the procedure take?
About 20 minutes from start to finish.
Is there any pain associated?
Some people, it can be a little irritating, but as long as you tell me what your pain tolerance is when we start, we can work with you. We have different tips. So we have sensitive tips for people with rosacea, and we also have more aggressive tips. So we can actually do feet, heels, we can do the back, we can do elbows. So we can get to a pretty aggressive tip. But the tip that I'm going to use here on Mercedes is a very fine tip, so it's not going to be irritating at all. And you can just let me know if you get too irritated. So we're going to start out on the forehead, and you can just watch to where you can see it gets a little red. It's not very irritating at all. Mercedes, what's your favorite thing about this?
My favorite thing is it makes a very good glow to my skin, and I feel like my skin feels very hydrated and just like fresh, clean.
Does it help your products go on afterwards?
It does. It helps them be more efficient for my skin.
I always like to use a really good antioxidant immediately after I do the microdermabrasion because I feel like your your pores are so exposed. So I like to use the CD Ferulic on people that have more dehydrated skin, and then for people that their skin is a little bit more oily, I like to use the Florentine. Those are both her SkinCeuticals. Since she does have rosacea, you can see that she gets a little more red right through here, and so I only go over in her cheek area for 2 passes, and then I move down to the rest of her face.
And I also use the Alto for my antioxidant and my rosacea.
Yeah, so she loves she's been using the Skin Better Alto, and that's a really good antioxidant as well. But also helps with the red undertones that you have in your skin. So it's completely safe with people that do have rosacea.
You mentioned you can do this all over the body.
Absolutely. And it is recommended to go you can even have this treatment once a week on other areas of your body, like your feet and your elbows and your back. It's not going to be too irritating. Those areas of your skin are much more tough, and it will require you to come once a week for about 3 treatments. And then just maintenance after that.
If people are trying to decide between this and the dermaplane, what would be your suggestion?
Well, they're completely different. So the dermaplane is great if you want to have an immediate glow, but also if you struggle with those fine lines and wrinkles with the fine hairs. And so it's almost like shaving your face, but we don't call it that. So it will help with all the fine hairs. But it's just a nice exfoliation that's physical and not chemical. This is going to be a little bit more different. It actually has a dermalogic infusion that goes into your skin, and so that's going to be the difference. This is going to continue to help your skin over the next 28 days, and it's going to continue to help with your own skin rebuild its collagen and help with fine lines and wrinkles, which the dermaplane does not do that because it's not a product that's going onto your skin for a solution. It's just using a physical exfoliation, and that's it.
Do you have to make an appointment with a doctor to get
Not
before you
for
get this done?
No, you don't. You can actually just call and make an appointment for this procedure alone. And if you're hesitant about it, you can always just make an appointment for a consultation first.
So she won't need as much of a moisturizer as she...
She will. I mean, everybody needs a moisturizer. This is going to be putting a lot of hydration back into her skin, but everybody needs a moisturizer, and they need a daily moisturizer.
Is there a pattern that you do, or a certain past pattern that you do every time?
It does. I do. It depends on the person, but so with someone that has rosacea or somebody that gets irritated in certain areas, especially with someone that's been coming consistently to me monthly, and it's very compliant, I learned patterns that I do. So for her, I actually start out with the forehead, and so I do the forehead, and then I do the cheeks, and then I do down the chin. But the cheeks, I actually watch to see how she's going to react to it, and so the cheeks, I change it every time with her because she's different every single month. But the cheeks, I do only do 1 to 2 passes, and then I do the rest of her face.
Are you still on the first solution, or are they administered simultaneously?
So no, you actually have to change the solution yourself. So I'm about to change over. So the first solution I used the aloe, and then now it's over the skin purifying. So this one that I'm doing now is going to be more for the acne because she's also acne prone, and so you only want to do it in the areas that she's acne prone. So for her, she looks like she's having breakouts right through here, but that's actually irritation because she started a retine, so I'm going to avoid this area right here, and I'm only going to do right around the chin area when I swap over.
So it's very customizable.
It is. Are you okay?
I'm great.
Would you be able to do a chemical peel after this? What do you recommend?
You can, and I just different chemical peels for all different skin types. So for her, right after I get done, I'm going to do just a 2% lactic acid chemical peel, which is great for her because it actually calms her skin down. Because a lot of people think when it comes to a chemical peel that it's going to be too irritating and that their skin's going to be peeling. But with the chemical peel that I'm going to do, it's actually going to calm that down.
With this procedure every month, I feel like my pores are deeply clean, so I don't feel like they're all clogged up, and I feel like I don't break out as much as well.
So she's done with
She
that
is.
with that part of it at
Yeah,
least.
so now I'm just going to put an antioxidant on her and a moisturizer.
Hi, Mercedes.
Hi.
Isn't she pretty?
Stop.
See, and if she actually, I mean, she normally gets much more red, especially in this area. And see, that's the thing about the microdermabrasion. Depending on your skin type, we can customize it. So Mercedes is actually already calmed down.
I have a question. What is an antioxidant?
So an antioxidant is, I feel like it's beneficial for everybody. It's going to really address more of future damage and help prevent that. But it, I have also seen where it helps to get rid of or even out the skin tone and help with hyperpigmentation. So I feel like everybody needs to be in on antioxidant, especially with our weather.
How do you handle it when it's a man getting a microderm as far as the facial hair goes?
So that I have a lot of men that actually consistently come and have a microderm once a month, especially people that get the ingrown hairs. And this is one of the most popular procedures that I do for men. And I will just address it for each different person. But you always want to go against the growth of the hair. And so for people that really struggle with the ingrown hairs, especially in the beard area, you'll want to just go against it, and it will actually help to calm that down. So people that normally come, they'll want to come once every 4 to 6 weeks for that. You burning it off? Mm-hmm. Perfect.